Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you've been feeling unusually tired, your bones ache, or you're wondering whether you're deficient in vitamin D, there's one thing most people don't know. You don't need to schedule a doctor's appointment to get tested. You can order a vitamin D blood test online, pay between $40 and $80 out of pocket, and have results within days. In this video, we're walking through exactly how that works, what the test costs, which services let you order without a prescription, and how to interpret your results based on what Mayo Clinic and the NIH say is normal. According to Medline Plus, vitamin D is a fat-soluble vitamin that helps your body absorb calcium and maintain bone health. It also supports immune function and regulates inflammation. A deficiency means your blood levels drop below what's considered optimal, typically below 20 nanograms per milliliter. The NIH notes that about 1 billion people worldwide have insufficient vitamin D levels, often because modern life keeps us indoors and many people don't get enough sun exposure or dietary sources. This isn't a rare condition. It's common and often undiagnosed. Mayo Clinic lists several signs worth investigating: persistent fatigue that rest doesn't fix, bone or muscle pain, muscle weakness, or frequent infections. Some people have zero symptoms, but are at higher risk. That includes anyone with limited sun exposure, darker skin in northern climates, digestive disorders that affect fat absorption, or anyone over 65. The Cleveland Clinic adds that if you have osteoporosis or are planning to start vitamin supplementation, a baseline test gives you solid data. You don't need to wait for symptoms. Many clinicians recommend testing if you fall into a high-risk category. The blood test itself measures 25-hydroxyvitamin D, the form your liver produces that shows your total vitamin D status. When you order online, you'll receive a kit in the mail or go to a local lab. You stick your finger, collect a small sample of blood, and mail it back to the lab in a prepaid envelope. It's a dried blood spot test, meaning the sample is stable at room temperature and doesn't require overnight shipping. Results come back in 3 to 7 business days, usually through a secure online portal. The CDC notes that this dried spot method is highly accurate and is increasingly used for at-home testing. Let's talk money. Direct-to-consumer vitamin D tests typically run $40 to $80 if you're paying out of pocket. That includes the kit, collection supplies, lab processing, and online results delivery. Some platforms bundled with other tests, like a general wellness panel, run higher, usually between $80 and $150. If you have insurance and get a test ordered by a doctor, your copay might be $10 to $30, but you need a prescription. Most people without insurance find the direct-to-consumer route cheaper than scheduling a doctor visit just for this. Several well-known labs offer these tests. Check their websites for exact current pricing, as costs fluctuate. Several reputable companies let you order vitamin D tests without a doctor's prescription. Most require you to be at least 18, verify your identity, and answer a basic health questionnaire for the lab. Popular options include LabCorp's direct-to-consumer arm, Quest Diagnostics online platform, and specialty services like Everlywell or Let's Get Checked that focus specifically on at-home testing. When you choose a service, make sure the lab processing it is CLIA certified. That's the Clinical Laboratory Improvement Amendment certification that the CDC requires for accurate results. All the major platforms display their certification status on their websites. When your results arrive, here's what Medline Plus and Mayo Clinic consider standard. Over 30 nanograms per milliliter is generally considered sufficient for most people. Between 20 and 29 is considered insufficient. Not deficient, but below optimal. Below 20 is deficiency. Some researchers argue that optimal should be higher, around 40 to 60, but this is still debated in the literature. Your results will show your exact number. The key is to understand that this is educational information to discuss with a clinician, not a self-diagnosis tool. If your level is low, a doctor can help you figure out whether supplementation makes sense for your situation. If your test comes back low, you have options. First, consider whether you can increase sun exposure. The NIH notes that 15 to 30 minutes of midday sun several times a week can help your body produce vitamin D naturally, depending on your skin tone and location. Dietary sources include fatty fish, egg yolks, and fortified milk. If those aren't enough, oral supplements are inexpensive and widely available. But here's the important part. Before you start supplementing, share your results with a healthcare provider to rule out underlying conditions that might affect vitamin D metabolism. It's one piece of health information, not the whole picture. Here's what you should remember. Vitamin D deficiency is common and treatable. A blood test is cheap, quick, and available online without a doctor's order. Results give you real baseline data to discuss with a clinician. You're not getting diagnosed by taking the test. You're gathering information. Mayo Clinic, the NIH, and Medline Plus all recommend this kind of testing for people with symptoms or risk factors. The process takes less than 10 minutes, and you'll have answers in under a week. Knowledge is the first step to feeling better. Check the description for links to certified lab services and reputable health information sources we referenced today. What type of health tests are you interested in? Comment below and we will make a video about it.